Well, welcome back. When it comes to talking with loved ones about advanced care planning, it can be difficult to know where to start. Adam Koontz, Director of Advanced Care Planning at Novant Health, joins us today and hopefully bring us some answers too. Good to see you.
Absolutely. Thanks for having me.
All right, so what does advanced care planning involve?
Advanced care planning is a process to identify what matters most to you. It can include identifying a healthcare champion, the person you trust to speak for you when you might be unable to make medical decisions for yourself, and talking with that person and others about some of the other medical decisions that you may face now or in the future.
So now, is that like a living will?
It can include a living will, and certainly in years past, advanced care planning has focused on documenting what you don't want when you're dying. Mm-hmm. In more recent times, we focus a lot more on talking about what you do want while you're living. And so completing a living will can be a component of that, but we really focus on the importance of the conversation. Mm-hmm. And having that conversation with your family, and with your doctors to think about what matters most to you, what your values are, and what your preferences are.
All right, so at what age should we start thinking about that?
Well, we really encourage anyone to start thinking about it. The reality is that none of us know what tomorrow holds. And so we could face an event such as a car accident, an operation that requires anesthesia, or a serious medical event like a brain injury. And that would leave us unable to make our own medical decisions. And so talking about what your preferences might be, what matters to you, what aspects of your life you can't imagine living without, and talking with your family, your doctors and your care team allows everyone to operate with a peace of mind. Mm-hmm. And when your family needs to make decisions for you or the medical team, they can do that knowing that they're honoring your wishes.
All right, and if you don't have something like that, what happens?
Well, if you don't have documents in place, there's a process that goes about it. There's a state statute that tells us who would decide for you. So in many ways, to not make a decision is to make a decision, because we'll follow the state statute and talk to whoever that person may be. That may or may not be the person that you would want making those decisions for you. So by going through this process, you ensure that someone that you want speaking for you is the one that's making those decisions when the time comes.
And in the absence of a family member, is that your medical team?
It certainly can be. We go down like I said, the state hierarchy that can go through family and relatives, or can be a close friend or someone that knows you and can speak on your behalf. But if no one's available, it could be a member of the medical team that would act in your best interest, especially in an emergent situation. All
right, so now where can people go to get help in leading them smoothly down this path?
Viewers can certainly log on to our website at novanthealth.org/choicesandchampions, or call us on our toll-free Choices and Champions call line, where myself or one of the other members of our Choices and Champions team can help personally walk you through the advanced care planning process and get the information that you need to get started. Viewers can also get information from any Novant Health clinic or one of our hospital facilities.
But just get started.
Absolutely.
All right, good deal. Thank you so much. We appreciate you.
Thanks for having me.